Here we have a presentation that will show how near-infrared findings can be associated with very different outcomes in relatively similar patients in other aspects. So these are two different patients with both of them had a severe stenosis at the ostium of the LAD. The stenosis doesn't show well in this view, but it's there at the proximal LAD, tight enough to require a stent. So in that aspect, the Beaumont patient on the left and the VA Medical Center patient from San Francisco on the right are quite similar. However, they differ in lipid core. This shows a chemogram on the left taken from the Beaumont patient. You can see there's a massive amount of lipid in the proximal LAD, even extending back into the left main. In contrast, the patient from San Francisco on the right has almost no lipid in the left main, and in the proximal LAD there's a little lipid distal. So both these patients were stented, and you can see post-PCI, the chemogram from the Detroit patient shows that the lipid is still there, and actually the stent ends in that lipid, and the lipid, if anything, is a little more prominent in the proximal LAD. Patient on the right had a fine angiographic outcome, and there's not a post-stenting chemogram. So how did these patients do? Well, the patient from Detroit, the one on the left, is of course sent home with the knowledge that this stent ends in a lipid core and that there is lipid in the left main, and this was of concern to the physicians, and they maximized medical treatment and hoped for the best. The patient on the right was sent home knowing that there was fibrotic tissue in the proximal LAD in the left main. So what we find 6 months later is that the left main of the Detroit patient, which had yellow, is now 80% occluded, and the circumflex is completely occluded. This patient is very fortunate to be alive, having gone through a shutdown of the circumflex and that terrible LAD narrowing. And at this point, the patient was sent for bypass surgery, and the physician who treating this patient said that the next time he sees that much yellow in the proximal LAD in the left main with the stenosis, he would tend to send that patient to heart surgery, to bypass surgery immediately. In contrast, on the right, the patient that had the stent put in the fibrotic areas by near-infrared is event-free. So here you have a situation in which the angiographic appearances were the same, the lipid core was markedly different, and the outcome was much worse in the patient that had a lot of lipid. We think that the knowledge of whether there's lipid present or absent can be useful in cases where there is a close call between whether stenting or surgery is indicated. The presence or absence of lipid can serve as a tiebreaker in some of those situations.